Hi, I'm Dr. Mark Poray, a family and sports chiropractor in Whitby, Ontario. This weblog is about spinal osteoarthritis. In 27 years of practice, I have learned that this term causes quite a bit of confusion regarding what it actually is, what causes it, and how to avoid getting it, as well as treating it. The word osteoarthritis comes from the Latin, as do most medical terms, and it means inflamed joint. It's sometimes confused with osteoporosis or with rheumatoid arthritis. Now, osteoporosis is actually the loss of bone density. It comes with age, but it does not necessarily change the shape of the bones. The bones simply lose their mass and become brittle. Rheumatoid arthritis, on the other hand, is an autoimmune disorder and is often associated with gnarled or disfigured finger joints. Osteoarthritis, on the other hand, is commonly associated with wear and tear, but it can also occur as an acute condition following a joint injury. This most often disappears as the joint heals. The kind I want to talk about is the result of wear and tear in the spine, because it can be avoided and it can be treated. The spine is a dynamic structure made up of 24 movable joints, 5 fused bones in the sacrum, and 8 or 9 tiny bones in the coccyx. The bones of the sacrum and the coccyx don't normally move, and so they're not really subject to wear and tear. All the other bones move to varying extents in 6 directions: left and right bending, left and right rotation, and forward and backward bending, called flexion extension. These movements are controlled by a large number of muscles, which in turn are activated by spinal nerves. As long as all the muscles pull equally, and to their full potential, the vertebrae will continue to move normally and are extremely unlikely to wear unevenly. However, the moment some of these muscles start to exert uneven stresses in their lines of pull, you have started the process of uneven wear and tear. If this continues, the body starts to make its own corrections to these uneven stresses. It starts to deposit calcium into the areas of the greatest stress to reinforce them. The results of this are called spurs. These spurs are sharp and actually become another source of irritation to the local nerves around them. That irritation is quite often painful and causes the body to make further corrections, which in turn advances this process of degeneration. In the meantime, these uneven stresses speed up the wear and tear on the discs, causing them to thin. The thinning of the discs and the formation of spurs causes more irritation, which results in inflammation and pain, and then becomes a self-perpetuating cycle. The ultimate result is osteoarthritis. Now, there are a number of ways in which osteoarthritis is treated. Medically speaking, these involve anti-inflammatory oral or injected drugs, which have varying degrees of success in controlling that inflammation and pain. There are natural substances which do similar things, like turmeric, which is packed with COX-2 inhibitors, the power behind drugs like Celebrex. You can take glucosamine with MSM in an effort to restore the joints. These will all have limited success and will really do nothing for the underlying problem: uneven wear and tear. There are laser treatments for the inflammation and the pain. Again, limited success. There are TENS units to deal with pain. Their main purpose, as far as I'm concerned, is to make people like Dr. Ho wealthy. Surgery is a viable option for replacing arthritic peripheral joints like knees and hips, but currently there is no effective surgery for this type for spinal joints. So it would seem that the most viable way to avoid spinal osteoarthritis is to maintain normal spinal biomechanics. That means maintaining optimal fitness levels, including balanced muscle strength throughout your core. It also means correcting uneven stresses on the spine resulting from accidents, overwork, or repetitive stress. Repetitive stress includes proper sleeping postures on supportive pillows and beds, and it also means regular visits to your chiropractor. It's the chiropractor's job and goal to find the areas of uneven stress on the spine, to stabilize the motion of the vertebra, and to optimize the action of all the muscles in the back to avoid osteoarthritis in the spine. You may have been told that osteoarthritis is a normal part of aging and there's really nothing you can do to avoid it, but this is simply not true. If there are no other factors like scoliosis, etc., then seeing your chiropractor to maintain optimal spinal biomechanics about once a month is suggested. This principle is the same one that you're already aware of in seeing your dentist every 6 months or seeing your family doctor every 1 to 2 years. Remember, just because you don't see spinal joints the way you can see your teeth doesn't mean they don't need care. If you don't take care of your teeth, you can replace them. But if you don't take care of your spine, you'll be in for years of pain, discomfort, and a loss of the activities that you enjoy the most. Thanks very much for viewing this. I hope it's been somewhat informative and helpful. I'm Dr. Mark Poray. You can see more web blogs on my website at www.drporay.com, or you can make an appointment to see me at the Brooklyn Family Health Center in North Whitby by calling 905-655-5767.